Hello, I'm going to make a big deal about the volume, and I've got a little lapel mic in, so I'm hoping the volume is working. So that could be a bit awkward because I'm doing a bit of research at the moment, my Facebook Live videos, and I've realised that the vast majority are not watched with the sound on. So I'm going to do a bit more subliminal messages about that to see if that will help my statistics. I tried last week and failed, so my statistics still said that 70% of, or 80%, some ridiculous statistic said that loads of people are watching without the volume on. So I'm just hoping the volume is working and I don't make a big deal about putting the volume on. I mean, 70 or 80% watching these videos without the volume on. What else is there? I don't know. I don't know what. I guess they just scroll. Does it just mean they're scrolling and they're not even? I don't know. I mean, you're clearly watching it with the volume on. I mean, I've got a successful. I've got a successful podcast, which just put that spot. Oh, sorry, spot the difference up there. Which obviously. Which these go onto a podcast every week, so please subscribe to my podcast. Reading comments, maybe. Yeah, okay. Good point, Shona. Good point. I like it. I like that, Shona. But also, yeah, the difference is here. Oh, now where is it? That's the difference. That's the difference there. Yeah, no volume. Okay, that's why I'm a bit late today, because I've been doing the props. I think that's been time well spent. I'm sure you'll agree. So yeah, I sent out a plea for more questions, but my plea has not really been answered. So anyway, so I've got a couple of questions here. So Shona, go and ask me a question. If you got, please ask me a question. And you know what else I can do? I can share the screen with you if you want. Oh no, I can't on this. I could on my phone. So yeah, I've got a couple of questions. So please, as ever, ask if you've got a question, ask in it live. First question. See, there's more props. My last piece of paper, so I had to write on the back of that one as well. Skin cancer. We've got a patient who has suspected skin cancer, and we basically have quoted her to have that removed, and it's more expensive than removing a mole. And I think there was a query as to why it's more expensive than removing a mole, because I can understand how you might think removing a skin cancer is the same as removing a mole, but it's not. There's a couple of reasons why it's more expensive. Number one reason is the histology is more expensive. When we do histology, which means sending it off to look at it under a microscope, which obviously you always have to do for a skin cancer, you put on the histology form what it is, and they have a price for mole. They charge more for skin cancers because if it's a skin cancer, they have to analyze it more deeply or not deeply, but more extensively, and they have to analyze the whole border of it to make sure that all of it's removed. Whereas if it's a mole, they're just really saying whether it's a benign or a cancerous mole, and if it's not a cancerous mole, you don't have to worry too much about having removed it all, although they do tell us whether we removed it all or not. So the histology is more expensive with a skin cancer, but also the surgery is more expensive, because with a skin cancer you have to remove a rim of normal skin. Skin cancers, there are different types of skin cancer, ranging from the melanoma, which is the worst one, which is a mole, usually a pigmented lesion that changes in some way, bleeding, itching, little red marks coming around it, erythema, changing in size or shape. So these sort of things are worrying features of a mole, which might mean it's a melanoma, and that's a serious type of skin cancer. And then there are other types of skin cancer called BCC, basal cell carcinoma, and SCC, squamous cell carcinoma, which are less serious, but now nonetheless need to be treated. And what you need to do with the skin cancer, if you need to remove it with a rim of normal tissue. And so certainly for a BCC or an SCC, you need to remove, make sure you get it all removed with a significant rim of normal tissue. With a melanoma, a little bit different. You usually just take that mole off, because usually it may not know it's a mole before you, melanoma before you start. So you just take the mole away, get that analyzed, and then you come back another day and take a much wider area, both around the outside of the scar and also deep. But you need to take a margin. The bottom line is you take a margin of normal skin with a skin cancer, whereas with a mole you just remove the mole. And so you have a bigger excision with the skin cancer. It's a bigger deal. And if you don't get it all out, you have to go back and take another bit away. So it's a bigger deal. Skin cancer is a bigger deal than a mole or a non-cancerous type skin lesion. And so it's more expensive to have skin cancer removed. That's a good question, though. And I'm grateful to you for asking that question. Next question, if we've got any more, moderate profile plus implants. Okay. Moderate plus profile implants. So we've got a patient who I've seen in clinic, and we said, look, you can have moderate profile or high profile or extra high profile. She's now gone away, she spoke to some people, and she's come back and thought, you know what, I want something between the moderate and the high profile, and I've heard about these moderate plus profile implants, and would they be suitable for me? And I do hear that quite a bit, about people say, oh, moderate plus, that sounds good, that's between moderate and high. The problem with implants is that I totally it's a difficult thing choosing implants, and I totally understand why people might think that moderate plus is a little bit more than moderate, but not quite as much as high, which is true. It is true in the range. So moderate plus refers to Mentor. Mentor is a make of implants, and they make low, moderate plus, high, and they also do ultra high. They call it ultra high instead of extra high, but anyway. So they do make the moderate plus profile implant, but it is not necessarily between a moderate and a high profile implant when you compare it to another make. Obviously within that make it is, but if you have, I always say to people, look, if you want a certain make of implant, we can have that one. So if you want a Mentor implant, we can go with a Mentor implant. I tend to use Nagor when it comes to silicone implants, or Polytech when it comes to polyurethane implants. Polytech are the only people that make polyurethane implants. Silicone implant, there's quite a lot of makes, Nagor, Allergan, Mentor. There's quite a lot of people who make silicone implants, and what you've got to look at is the dimensions of the implant. Don't go too much, or don't go so much on the name of the implant. So don't think that moderate plus is going to be less profile than a high profile of a Nagor, because it all depends on the dimensions. It depends on the width, and it depends on the projection in a number term, in a sort of like 4.2 centimeters projection, 11. I'm making these numbers up, I don't know, 11.5 centimeters width. So it's all on the width and the projection. And some companies, there's no set thing of what a moderate profile implant is and what a high profile implant is. And some companies will have a higher projecting or a lower projecting implant and still call it a high profile, if that makes sense. So a high profile of one company may be different to a high profile of another company. So I use Nagor implants, so I show photos of people who've got Nagor implants, and what you've got to think of it is maybe with a different company. This was a real problem for me with Silamed, which was another company that made polyurethane implants, because Silamed used to be very high, or not very, but more high projecting than Polytech. And so a moderate profile Silamed was like a high profile Polytech. So, if it's not confusing enough as it is, there you go. There's more confusion right there, because you can't just go on the name. And I understand how you might think a moderate plus sounds better, but you will find dimensions wise, it will be similar to another, maybe a moderate. I think I did look at it earlier actually. Got them here. So you've got the books here. But a moderate profile. So yeah, I was looking at, so like a moderate plus profile Mentor implant for a given volume actually had less projection than the moderate profile Nagor implant. Yeah, so moderate plus profile, say 300 cc, moderate plus profile Mentor implant is 3.7 3.7 centimeters projection, whereas a moderate profile 300 cc implant in a Nagor is 4.2 centimeters. This is a problem with the live video because I don't think I've made that very clear, but you know, what can I say? The bottom line is that I can't do it again. Can't bring it back. I should have done more visual clues on this one. I spent all my time doing these spot the difference stuff. I should have done it on this. That's what I should have spent my time doing. Thank you. So, oh, look at that. Is it interesting? Thank you. Well, the bottom line is it's all about the dimensions of the implant, not the name of the implant. So just because Mentor call it moderate plus doesn't mean it's got more than a moderate Nagor. Because for a 300cc implant, moderate plus has got less projection than a 300cc Nagor implant, so it doesn't matter the name. That's the thing, and that's what I'm. And actually, we could bring this out because I've got no more questions. So I'm going to bring this out. I'm going to keep going on this one, and we can bring it out on volume. See, this is the problem with volume. People say I've got 200cc implants in, and my friend's got 300cc implants in. Hers are bigger than mine. Now, that's only one dimension. The volume is only one dimension. What about the shape of the implant? If you are quite narrow and you've got a narrow 200cc implant, that might stick out a lot. Whereas if your friend's really wide and she's got a 300cc implant that's over a wider area, hers might be a lot flatter. Hers might be a much lower profile than yours. So yours might look bigger than hers. Even though yours are 200cc's, hers are 300cc's. Does that make sense? So it doesn't all matter. It's not all on the volume. When people talk, they really focus hard on the volume, but you can't. It's all about the dimensions. It's about number one, the width. Number one is the width. For me, anyway, I always go on about the width. The width has to be right. When you walk in the door, there's a certain group of implants that will fit your frame, whatever you think. People come and try on the sizes. I think I can have any size I want. No, you can't really, you can try on any size you want, but it might be that your frame will only take a certain, selection of widths, and then you choose a profile depending on how much it sticks out. You have teardrop or round, so that's a shape, and then a profile meaning how much it sticks out. Some stick out more than others, and you have to, once you've got a width and how much it sticks out, a profile, that will then be a volume. People often start with a volume. That's why I don't do the Rice test. You see my blog post? When's that blog? Was it this week or whenever? I did a recent blog post saying I don't tell people to do the Rice test because all the Rice test talks about the volume. They go home, they try the Rice test, they say, that's it, 400cc's, bang on, I'm loving it. I want a 400cc implant, please. I'm like, what? 400cc teardrop, 400cc round, low profile, moderate profile, high profile, extra high profile. There's loads of 400cc implants. 400cc's, the volume's only one dimension. And even then, when you get to profiles, as I said, moderate plus, it's different between different makes. It's a minefield. It's my life, and it is confusing. And I hope I haven't made it confusing what I've been saying there. I'll have to look back on it to see if I confuse myself. But it is confusing, and I am sorry for people when they come to see me in the clinic because they come thinking they just want the 200cc implants because their friends got them, and then I go on about all these dimensions things, and they're like, oh my Lord, I didn't think of this hard. But it's what it is. Whether or not you say it, it's the fact. You have to get the dimensions right, and that's what we try and do here. We try and get your dimensions right. And that means that you sometimes have to come back because you think, oh, I'm not sure because I wanted that size and I want that profile and I'm not so sure because I can't have that size and that profile because my width would be too wide for me. And if there's ever a judgment between size and profile, I'm going to go. It's all right. It's okay. I'm going to go in a minute, all right? But I just got one more thing to say. If it's ever a judgment between size and profile, stroke shape, so I'm going profile and shape in one side, size on the other, profile and shape wins every day, not size. People think size because they want to go and tell their friends they've got this size of implant, but don't go on size. Don't go on size. go on shape and profile. Shape and profile is key. If you get a shape and profile that is good and the size isn't right, you'll be happy. You'll probably say, I wish I'd gone bigger, because everyone does say that. Most of my patients say they wish they'd gone bigger. But if you get the shape and profile right and get the look right, they're happy patients. It's much better than going on volume, going on size, which is why the RICE test, I say don't go the RICE test, because the RICE test only talks about size. You just go on size and you don't focus on the shape and the profile, and you just go for this sort of size, and you get something that is a shape and profile you don't like, you may well be unhappy, particularly if it's too full, too rounded. You know, that's the path of unhappiness. Now, some people want that, and that's fine, but you have to have a discussion beforehand. Whew! I have to have a lie down now, I tell you. Right. So I think that worked well. I'm going to look forward to my statistics this week. I think last week was a 70% no sound crew, so I think it was a bit better, because it's normally about 80%. So, you know, there was a few more sound people turning the sound on, but, you know, as Shona says, maybe it's looking at the scintillating chat that's going on. So maybe that is the reason for watching, rather than the talk that I give. Obviously, the chat might be something that they're doing rather than listening to the talk. So that's that, and that's all I've got. I've given it all this week. Next week, happy Easter. Hope you're enjoying your Easter holiday. If you're on holiday, I'm on holiday next week. Woohoo! So I probably won't be here. Well, I probably will be here, as in the clinic, but I don't think I'm going to be doing this, because I'm probably doing some crazy events with my family. So but the week after I will be. So by all means, ask a question. If you've asked a question here and I missed it, goodness knows where it is. I'll find it and I will answer it, and we'll bring it next week. And if you've got any questions, please email or do it on here. You know, Facebook me or Twitter or whatever, and I will be very happy to answer them. And so I think that's been a good one. I've enjoyed it. thought it went well, and I'm gonna go and you know, go and pick up the piece of paper that I just dropped behind me now. Okay, see you next week. Bye. End.